As of the 20th of April, we have detected 7 local COVID-19 cases with the B117 variant and 1 local case with the B1351 variant. This is otherwise known as the South African variant. Case 61822 with the B1351 variant or the South African variant works in the marine industry and was exposed to potentially infectious sources from ships visiting Singapore. The remaining 7 cases that we've identified, and these are cases 59028, 59059, 59084, 59340, 59351, 60389 and 60439 were all infected with the B117 variant, and this is otherwise commonly known as the UK variant. All necessary public health actions have been taken promptly to isolate and ring-fence all these cases. And while there have been transmission to members of the same household for 3 cases amongst these 8 cases, there has not been any detected further community spread. In addition to these local cases, we have detected 342 imported cases, travelers from various countries coming into Singapore with the B117, the B1351, the P1, a Brazilian strain, otherwise known as the B11281, the P2 variant, otherwise known as the B11282 variant, and the P3 variant, which is known as the otherwise known as the B11283 variant. The B1525 and B1617 variants have also been detected among imported cases into Singapore. All these cases have already been placed on stay-home notice or isolated upon arrival in Singapore, and we have not detected any further community spread for any of these other variants of interest. We continue to test all cases of COVID-19 infection that we've detected, but as more cases are reported, more testing is done. These numbers will change over time, and in the future, we may provide further updates to you. Thank you.
Hi, good evening, Ministers. Thank you for the information. Can we ask about how concerned exactly are we about the emergence of these new variants, especially the so-called double mutation variant from India, and the phenomenon of reinfections? And does this, beyond the dormitories and the measures related to migrant workers, does this affect our plans for further reopening?
I'll ask DMS to talk about the new variants, and maybe Minister Tan See Leng can respond to the question on the dormitories.
Thank you very much for the question. We are indeed monitoring the situation very closely. There are emerging evidence that some of the viral variants of concern may have an increased risk of breakthrough, but yet at the same time, for many other variants, this has not been seen. The data for the double mutation variant, which you mentioned, is still emerging, and we are monitoring the situation closely to see whether this would be a concern, particularly for us, in relation to travelers coming to Singapore and at risk of imported cases. You've asked also about reinfected cases, and these would obviously be in persons who have recovered from infection. We do know that persons who recover from infection, the majority of whom develop an immune response that does protect them for a significant period of time from further COVID-19 infection after they recover from that first infection. However, over time, there have been studies that show that for some individuals, the antibody levels that are present in their body do wane over time. We've done our own local studies looking at 2 different populations, one followed up by NCID for recovered cases in the community, and a second that looks at workers in the dormitory setting being followed up, and we demonstrated that in both groups, they retained the antibody response for significant periods of time, well above 300 days. However, over time, that antibody response does come down, and it is theoretically possible for a recovered person to get reinfected subsequently. And this is the reason why we want to be vigilant, particularly now when a number of our own recovered workers are starting to reach that milestone where they are above 300 days. And it's now prudent for us to start monitoring very closely for the risk of reinfection taking place. And this would be the basis for our enhanced posture for testing, not just among workers, but also for travelers that come into Singapore. And we will continue to be vigilant, looking out for reinfected cases as they arise.